Okay, recording started. All righty, awesome. Samantha, how are you? And welcome to our little chat here this morning.
Hello, Jodi. I'm good. How are you going?
Yeah, really well, thanks. So I just thought I'd start off by getting some of your background. So from what I know, you're a consultant psychologist. I know bits and pieces about some of the work you've done, but take me through a bit of a snapshot of your working career.
Excellent. Give you the spiel.
Yeah.
Okay. So yeah, as you know, I am a psychologist by trade. I've spent my career. I've done a bit of both. So I've done quite a bit of work, individually with folks in counselling settings, around their mental health and well-being. But I guess in more recent years, I've probably spent a little bit more time in workplaces and a bit more interested in kind of workplace mental health more broadly, beyond individuals and their experiences. So I do work for myself now. I've been a consultant off and on for a number of years, and that's always fun. As you would know, you get to go into workplaces and get an understanding and insight of how things work in different environments, which is also always really fun and really cool. Probably my interests have really been informed by my experiences over the years with the Queensland Police Service. So I've worked for them off and on over the years as well in a number of different roles. But I think when your interest is workplace mental health, the QPS is really one of those environments where, to be really honest, you see the best of it. Like when it works really well and when there's really good support, I think you see people really protected, their mental health and wellbeing really protected. But by the same token, obviously, there's lots that folks in that environment that are exposed to that can really impact significantly on their mental health and well-being. And it was probably in that environment that I increasingly became interested in prevention, in the idea that it's all well and good working with individuals and helping individuals to, in some cases, develop their coping skills. But there's a lot that goes on in work environments as well, where if we could do things differently, we wouldn't have people who are impacted to the extent that they, for example, go off on, become unwell and go off on due to injuries and illnesses and all of those kinds of things. Along the way, I did do a stint with the Work Health and Safety Regulator in Queensland in the Psychological Health Unit, and that was really valuable, that experience, because that really helped me to understand how that health and safety framework really fits well when we're talking about workplace mental health, and what employers really can do and should be doing to better look after the psychological health and safety of their staff. So yeah, that's where I'm at.
What sort of insights did you, when you talk about working with the regulatory side, what was it that came out of there that kind of gave you that more broad view of and an understanding of what you can, how you can make an impact?
I think one of the things that for me, and this was, I worked for the regulator prior to the codes of practice being really, and that big push and that momentum about psychosocial risk. But up until then, I'd worked in the workplace mental health space, and I was really trying to get more into that area of prevention. But it was a bit of a slog, and in many cases, I think I saw workplaces, even well-meaning workplaces, who just kind of thought, oh yeah, that stuff's nice to have when we have time, when we have money, when we have resources. Yep, we can dedicate some time to that. I think one of the things that was really valuable for me when I went into that space with the regulator was that really clarifying that actually this is a requirement under the Work Health and Safety Act. It is part of the primary duty of care for employers to protect both physical and psychological health. So for me, it really changed in the first instance, probably the language that I was using, because it was for me that, kind of leaning into the idea that it is in fact a requirement under the Act meant this is not something that is just a nice to have, that it's a bonus that you can do. Yeah, you actually you are required to do it, and so I think that was probably something that was really important. And then for me, the next part of it was really understanding that, I'd like many people, I'd done worked a lot in spaces where it was, the EAP, the staff counselling, staff training, and there's really a place for those types of programs, most definitely. But I think working with the regulator really helped me to understand how this actually needs to fit into broader systems, and how organisations really do need to be looking at this as on a systems level, rather than just trying to, I guess, even with counselling and things like that, once again, trying to fix things after perhaps, damage is already done or exposure has already occurred. Yeah.
Yeah. So taking a couple of steps back, you mentioned a couple of things, the code, or the code of practice that's now been implemented. We'll talk about that in a moment as well. But taking a step right back, when you say psychosocial risks, so for a business, just unpack a little bit. What does that mean? Because we hear that word now, it's becoming more and more mainstream, and psychological safety, but psychosocial risks. What actually are? What does that mean?
Yeah. So one of the things, I think, because we often you'll hear both terms, psychosocial hazards and psychosocial risks, and there's lots of places where those terms are used interchangeably, and that's not necessarily completely incorrect. They do certainly overlap. I probably do tend to talk about hazards and risks a bit separately, because I think you can be exposed to a psychosocial hazard, but that doesn't necessarily automatically mean that you're going to experience harm. So one of the ones that I often give as an example, it's pretty straightforward, is if you and I, Jodi, were in a workplace and we were exposed to the same critical incident. Let's say we were in a customer service environment and we had a customer who was really angry, aggressive, yelling, and all of those kinds of things, and you and I were both exposed to that. That's the psychosocial hazard, but that doesn't necessarily, just that exposure doesn't actually necessarily say anything about whether you and I might be harmed as a result of that exposure. So the psychosocial risk goes that step further and goes, well, what is the likelihood that you and I in that circumstance might actually experience some sort of harm, whether it's a mental health problem or whether it's even physical health problems as a result of being exposed to that customer aggression. And that's when you kind of drill down a little bit further, and it may be that, for example, you're younger than me, Jodi, so maybe you're
not
newer.
by much, I don't think.
But just own it, just go with it. So you're younger than me, so maybe you're earlier in your career. If you're an early career worker, you may not necessarily have developed some of those coping skills or some of those strategies. It may well be that I've had a background where I've had heaps of those types of incidents. Again, that kind of increases the risk. So it's really trying to look at what are the other variables, what are the other factors that combine with the exposure to either increase or decrease the chances that somebody may well actually develop some sort of injury or illness, or somehow be harmed as a result of that. So that's why I think it's important. I personally like to kind of separate out hazards and risks, because the hazard itself doesn't automatically go to harm. You really need to unpack, well, what are all of those other things that might be, as I said, increasing or decreasing the risk of harm.
It sounds like a lot of work and maybe complicated. So what does a business kind of need to think about, and and then probably lead that into the code of practice as well. Share a little bit about that.
Yeah. So the code of practice, as you know, does at its core, the code is really, there are a number of codes now across the country. Queensland has its own that looks a little bit different, from the model code, and WA has one that's slightly different again. But for the most part, they're all really talking about at its core, applying a risk management approach. And that means identifying the psychosocial hazards, assessing the risk of harm, implementing control measures, and evaluating those control measures. So the code of practice itself separates out identifying the hazards and assessing the risk of harm. I will say, in my view, I think depending on the size of the organisation, that risk management approach looks different at different levels of the organisation. So what a team leader is doing just in terms of looking after their team and applying a psychosocial risk management approach actually looks different from what a regional manager in a large organisation, or indeed the CEOs or the people at the top in an organisation need to be doing. What that risk management approach looks like at those different levels. I will say, when we're talking about, like I said, team leaders and even small businesses, I know it feels like it's actually quite complicated, but actually I think that there is a lot of things that I see folks at those levels, they're actually already doing a lot of things that actually are psychosocial risk management. They don't necessarily apply that lens. So, as an example, I think about if you're a manager or a small business owner, you've got somebody who comes into your office. They say they're stressed, they're really overwhelmed, they're not managing the workload, they're lying awake at night worrying about deadlines and all of those kinds of things, right? So as a manager, in the first instance, you're like, oh, okay, you want to try and listen to them, understand, try and figure out what's going on. You ask them a bit more about what the problems are, when this happens, what the issues are, what the concerns are. You find out a little bit more about how it is impacting for them. Okay, they're not sleeping, they're doing work on the weekends. It's, like I said, keeping them up at nights. And then you go, right, well, what can we do to try and fix this? So you make some changes, do some tweaks, look at the systems, whatever is most appropriate. And then you go back and follow up with them and check in and, see how they're going. That's actually something that managers do, every other day of the week in some cases. And of course, just that process, being able to respond to that. They're identifying the hazard, which is workload. They've assessed the risk of harm by understanding how it's impacting for that employee. They've asked the employee what's going to help, and they've made some changes to some processes to try and improve things. And they've gone back and checked in with them. And that's kind of the evaluation side of things. So I think it doesn't necessarily, at that level, at a team leader, small business level, it actually doesn't need to be more complicated than that. I think what can be helpful in those smaller team environments is just making sure that's documented, that you are applying that psychosocial risk management lens to what you were going to be doing anyway. Does that make sense?
Yeah, absolutely. So I know it's going to be different answer to this question depending on the size of the business, but when a business becomes aware of the code of practice, what are or they've recognised, and actually I'll deviate a little bit. We briefly spoke offline. Safe Work Australia released their 2024 annual report, and just to share some stats, 14,600 mental health claims, which represented a 20% increase. And 10 years ago, that number was 7,000. So, in 10 years, it's doubled. The median time lost is 5 times that of any other injury or disease. So 37 weeks is the average for mental health claims. And same again, the average compensation claim, 65,000, which is just under 20,000 more than the next highest cost per claim. Where, and then there's a question, how ready are we to defend our psychosocial risk management process? Where does a business, and maybe answer it from a larger business like a corporate versus a small business, where would they even start in this space?
In my view, some of the larger businesses that I've been involved with, there's actually already often a huge amount of organisational data that they can that they can draw from. You can do things, of course. You can do psychosocial risk assessment surveys, like the People at Work survey, which is a free tool, and it's an excellent tool. It's not the only one. There are certainly others out there. So if you really wanted specific data around psychosocial hazards and risks, those kinds of tailored surveys can be really helpful. But I'm always, particularly in large organisations, and the ones that I spend a bit of time with, and spend a bit of time, not surprisingly, working with government, I think that there can sometimes be a level of survey fatigue. So I'm always really cautious about, do we actually need another survey, or have we got enough data to be drawing on? So,
what sort of data are you looking for in that instance?
Yeah, so sometimes there is survey data that is already there. Lots of large organisations, they already do like an annual employee engagement survey, or, here in Queensland, the state government does the Working for Queensland survey. I know the New South Wales government has their own version of that. And actually, whilst those are not specifically psychosocial risk assessment surveys, you will actually find that there's a huge overlap with many of the concepts and the items on those surveys. So you can pull some of that out in the first instance for the purposes of hazard identification. It is things like, of course, complaints and incident data, the number of work cover claims. Now, we know that though that data tends to just be the tip of the iceberg, that there's lots that's not necessarily captured in those stats, but they can be a really good place to start with, because I think the easy part always in organisations is actually identifying the psychosocial hazards. If you go to any employee and go, so what are the things that mess with your head in this environment? They are going to be able to tell you, right?
Yeah.
That's right. They will know. And in fact, in many cases, everybody knows what the issues are. So I think, do a survey if you need to, but if you don't need to, if you've got some existing data, start there, right? But the next step, always, I think, I've not really been able to do a psychosocial risk assessment without really going to that next step, which is focus groups or employee interviews. Now, the Code of Practice and indeed the Work Health and Safety Act requires workforce consultation, so it's meeting that obligation. But I think even beyond the obligation, it doesn't matter to me how good the data is. I've looked at data sometimes and really done some analysis and gone, right, okay, based on this is what I think is going on. And then we go to the consultation, we do focus groups or individual interviews or whatever is going to work in that environment. And every single time when I start having those conversations, it actually ends up being, not surprisingly, a far more nuanced, a far more, in some places, complicated, in that there's interactions of different hazards and risks. There's often, in many cases, I've not come across an organisation where there isn't some good stuff that they're doing that is also, that's really helpful and protective, and that helps to mitigate some of the risks. So it's not until you actually have those conversations that you really understand what the data might be telling you. So I think and that's then going that next step to really unpacking, well, what is the risk of harm here? What sort of things are we seeing? What are the employees saying is impacting for them most, to be able to prioritise those psychosocial risks. So that's if I was going to a large organisation, and I guess this is some of the work that I have done. That's if we're looking in the first instance at just getting started, if you want to go with that psychosocial risk management, I think that's how you do it. Pull some data, identify your hazards, but most definitely start, do those focus groups, really talk to the workforce to try and understand what's going on. And that's kind of step one. I think in large organisation, then there's other questions about the overarching systems and how you integrate this with their existing work health and safety systems and incident reporting and those kinds of things.
And so what do you think? So do you think like the rise in the 20% just in the last 12 months, Do you think that's indicative of something bigger, or do you think that it's because we talk about mental health more now, we have the code of practice in place, there's that ripple effect that a psychological claim gets made in an organisation, other employees see that it was successful, they then go, oh, well, I've actually had similar challenges, they may go for a compensation claim. Do you think it's anything inside of that, or do you think it's something else? Like, what do you think is leading to this, over 100% in the last 10 years, but 20% just in the last 12 months?
Yeah, it's an interesting question, and it goes without saying that it is complex, and there's many facets.
Multifaceted. I realize it's a big question.
Yeah, I guess one of the things that I see, when I'm out there in the world and chatting to organisations, and again, particularly large organisations, one of the things that I see that worries me is it feels like, and I am owning this, as this is just kind of my observations and perspective, but it feels like the pace of work just keeps getting faster. It is far more rapid than it used to be. So when we talk about things like the job demands and resources model, that the job demands and resources model, which is kind of what sits under the psychosocial hazards listed in the code, suggests that every role, every job has a level of demand. So things that make you work hard, cognitive demand, physical demand, emotional demand, that kind of suck your energy. But it also has resources which make your heart happy, so having a really great boss and a good team environment and all of those kinds of things. I guess, I know I hesitate to say back in the day, when I was young, but it does feel like in the past, I can remember being in the workforce, and you could be in a job where there was a high level of demand, but you also had down times where maybe you had a bit of time to recover. And you also had maybe a little bit more time. Maybe there was more capacity to have those social relationships, have those that feel supported in the workplace, maybe have different levels of, autonomy and those kinds of things, again, depending on what the role was. So it's like, whilst in the past I've been in roles that have been high demand, if they're high resource as well, we find that is protective. But also, more importantly, I think if it's high demand, if you do still have some downtime at some point where you can have a break and breathe and recover, and then it ramps back up again. I don't feel like in the workplaces that I'm seeing anybody gets a break anymore. It seems like traditionally, at least in I know this doesn't apply to every sector and every work environment, but it's like it felt like as you came into December, everybody just kind of eased off, just kind of eased into the Christmas period. And then it took a little while into January, as for things to ramp back up. I don't feel like that's what's happening anymore in many workplaces. It feels like it is flat out, right up till the end of the year. People go away for Christmas, have 2 seconds to breathe, and it's almost right back into it at the same rate, once they come back from holidays in January. I just feel like, I wonder whether it is this interaction of just this burnout that we're seeing, because these work demands are just so relentless, and people just don't get the time to have a break, to develop those relationships in the workplace that can be really protective. They don't necessarily get the same sense of satisfaction, because it's like one thing, as soon as one thing's over, they're onto the next thing. So I don't know, that's just kind of my rambling thoughts, but it is one of the things that I worry about, is that intensity of work.
And so what can be done, and where do you put the responsibility as well? Obviously we're all responsible for our own mental health ultimately, but what can we do as if we're an employee, and also what can we do as a manager or a leader to kind of combat some of that?
Yeah, so starting first with as for managers and leaders, and probably, you know, again in bigger organisations, senior leaders, I understand that it is like at the moment because we've got you know we've got low rates of unemployment, so it's actually in many areas people their staffing resources are not necessarily what they need to be. But even beyond that, I think that there has been for a while this focus on, you know, doing more with less. So I think the resourcing is one thing, but that's not necessarily always the answer either. So a couple of times when I've done psychosocial risk assessments with organisations and workload is coming up, and the pace and the intensity of work is an issue. In one case that I was thinking of, they actually provided more resources, and it still didn't kind of fix the problem. But when you actually again consult with the workforce and sit down and have some conversations, you actually find that again, because there's no downtime, there were these systems that were just kind of clunky and bureaucratic, and as things had rapidly changed, they didn't really go back and have time to review where things have, you know, how things have been done in the past, and when there was opportunities to maybe improve those systems. They've just bolted new systems, you know, on top of the new work processes, new IT systems, all of those kinds of things. So it's actually not just the amount of change and the actual demand in terms of work coming in. I think that there are opportunities for being able to go, right, do these systems actually work with the human beings that have to work within them? Now, as I say, it's easier said than done, because that's the problem, isn't it? Nobody has the time to just stop and go, let's just think through this system and whether it's actually working for us. But yeah, that's one of the ones that I really encourage organisations, particularly when they're going, well, we can't fix the resourcing. Well, if you can't fix the resourcing, then maybe it's time to look at your systems and see if there's some things that you can do there that might actually make a difference for people.
Yeah, okay, cool. And so shifting gears a little bit, we've already been going for nearly half an hour, which is time just disappears.
Yeah, it does.
Yeah. Coming down, so Black Dog Institute during COVID released their white paper on modern work, and their number one recommendation for business was to train the leaders and managers in understanding mental health, or being able to understand the warning signs and symptoms, providing how to steer their workers to find support. When it comes to some of the heavy conversations, and this is getting right down to the frontline sort of interactions here. When I deliver my micro credential, which is training around mental health in the workplace, some of the feedback I've received is they're often too afraid to have the conversation. So they might understand, they've recognised that there's a team member that's struggling, potentially, and especially around things like suicidal thoughts and things like that. There's a barrier to even ask the question because they're worried about the answer that's going to come back and what to do in an instance like that. What can you talk into that?
Yeah, I do think that it's a good point that you raise, and I think there's a lot of research that suggests that if we really want to try and, what is one thing that would really make a difference in terms of workplace mental health, and I think it's leaders having the skills not just to have those conversations, but that is certainly an important part of it, but also understanding how you create an environment of that is psychologically safe and healthy for team members. That has a huge impact on people's mental health and well-being. But in terms of the coming to your point about leaders being able to have those conversations, I agree. What I've seen time and time again in workplaces is leaders, in many cases, it is not a lack of care. It is not a lack of or a lack of motivation, but they're really worried that if they step in and have that conversation, that it's going to open up a whole lot of stuff that they feel not well equipped to be able to deal with. But leaders actually, that perception of support and care from your line manager is incredibly powerful. I worked previously in an environment where there was kind of like an internal staff counselling, like an internal EAP. And so I was one of the people providing that internal staff counselling service. And so as part of that, if there were critical incidents or difficult things that were going on in the workplace, they would often get people in my role to contact employees to, say, hey, how are you going? Check in, offer that support and all the rest of it. And that's a good model. There's nothing wrong with that model. But one of the things that myself and my colleagues would say is that one call from that person's boss doing the same thing, expressing care and concern, one call, one contact from them was worth 100 from me as a staff counsellor, because it mattered more. It had more impact. People I think appreciated the call from me and the people in my role, but they also kind of went, oh yeah, but that's your job. That's what you get paid for, is to be caring and offer that support. Whereas if the boss did it, then they must really care. They must genuinely be interested in my well-being. So I do think it just has a massive impact. And I also think, and part of I know what you really emphasize in your micro credential is that actually, if you can have the conversation, if you can ask the question, one of the things that really increases a line manager's confidence about doing that is going, okay, if this does open up a whole lot of things that are going on for that person, and worst case scenario, things like maybe they're thinking about suicide, then knowing what you need to do and how you as a supervisor tap into support so that you're not left holding on to that all by yourself. You've opened it up and that's fantastic. Now it's about going, okay, we've got some things going on here. How do we get some help? Let's get those resources. So I see supervisors who feel really comfortable going, I know what all of the options are. I know how to get the cavalry coming in. If I have got somebody who's struggling, allows them to feel more comfortable opening up the conversation, because they know what to do if things are, if somebody's not doing great.
Yeah, it's that's really cool. I also do some work for the charity Livin', as you know, and we were trained by their head psychologist, and one of the things he emphasised there as well is we don't have to have the answers. And it can be as simple as showing a bit of empathy and compassion and saying like, oh, I'm so sorry to hear that. Look, I don't know what to do here, but let's find out together.
Yeah.
And just simple little things like that can really go a long way into, crossing that barrier, because it is a very common thing and people don't want to ask, don't know what the reply is going to be. Is it going to be too heavy for them to handle? And So, okay, so final question then for you. If you had a magic wand, unlimited resources, where would you throw your time and energy towards in this space?
To be honest, it actually would be in not just leadership development. Actually, if I had the magic wand, Jodi, it wouldn't just be about having leaders who have the competency in this space. It would actually be about magically fixing the systems so that the leaders have the time. So once again, I've seen lots of leaders who are really skilled. So it's not a skill gap issue. They're actually really motivated, but they too are so overwhelmed with work that they don't get the chance to provide the support to their staff that they would like to. And then, and I really feel for them, because then they also go home feeling guilty about all of the things that they, haven't been able to achieve. So if I do think that one of the best points of intervention is actually having line managers who really know their stuff. Once again, not just about having those conversations when people are not doing so well, but also in terms of creating that team environment that's really supportive of mental health and well-being. That would probably be the best point of intervention, having those skills, but also having the time to do what they need to do and actually demonstrate that support.
Yeah, cool. Awesome. And so Sam from Headstrong Workplaces, if people have listened to what you've been saying, maybe they're from a larger organisation and they're looking in this sort of area around the code of practice or psychosocial risk assessment for their organisation, how can they get in contact with you? And are you looking for connections into organisations?
Absolutely. One of the things that I'm really love to hear about is organisations doing all sorts of cool stuff that might be a bit out of the box, that's actually addressing, things like workload or poor organisational justice, or, so I think that there's still a gap for lots of employers in terms of what works, what actually is going to make a difference for addressing these psychosocial hazards and risks. So I really love hearing from workplaces who are just doing some really cool stuff apart from anything else, and kind of collecting some of those practical case studies that can be shared a bit more broadly. But yeah, otherwise, if there's a workplace who is interested, kind of going, where do we even start? What might be some first steps, or just needs a bit of a hand with psychosocial risk management? Obviously, I'm available on LinkedIn. You can go to my website, which is headstrongworkplaces.com.au. And you'll be able to I'm sure, find a way to get in touch.
Yeah, cool. I'll post some links wherever this is posted as well, so they can reach you that way as well. Awesome. Thanks, Sam. Really, very much appreciate the time and sharing your insights and your knowledge. It's always good to catch up and chat.
It absolutely is. I always love chatting to you, Jodi. We can talk for hours. So thanks. The audience will be glad we're stopping here.
Awesome. Thanks, Sam. Appreciate it.
Thanks, Jodi.